Hi, I'm Rick and I'll be your host for this episode of Excelsior TV. In a previous episode, we interviewed Bob Kordella, Chief Clinical Officer with Excelsior Solutions. Bob gave some rather surprising information about how pharmacy rebates could actually be costing you money. On this episode, Bob is going to be giving us some specifics to support those claims. Bob, last time we promised we would give some figures that could help us better understand this issue of misleading rebates. Could you give us some examples of how these rebates could be leading to actual higher costs?
We have a client in which it's a very highly utilized therapeutic category. The brand drugs, even though there are generics available, have a very prominent position both on their formulary and in terms of their utilization. And it's because Big Pharma has made the argument that the rebates make the brand drugs as inexpensive as the generics.
Okay, well that makes sense, doesn't it? Isn't part of the purpose of rebates to make these brands more competitive with generics?
Well, when we do a little analysis, what we find is that the amount that the rebate would have to be for that statement to be factually true is an amount in excess of 90% of the cost of the brand drug.
In excess of 90%, huh? Wow, that seems like a massive rebate amount. Is that even possible?
Is it theoretically possible that that payer is getting a rebate in that highly utilized therapeutic category of in excess of 90%? I suppose that it is. But it's not common if it is true. That's a case where those patients are using a lot of those drugs, and if that statement is even a little bit wrong, that payer is paying a lot more money on a net cost basis than they should.
I bet this is true for many payers, and that's scary because that has to be a lot of money. So Bob, how many payers are already seeing really high utilization of generics?
At a time when generic drugs are comprising in many payers' books of business 80% or more of the prescription claims that are dispensed, you can see how rebates are becoming of diminishing influence, diminishing materiality in the overall financial deal between a payer and a PBM.
Okay, so rebates are starting to have less influence. So I guess the lesson here is that we need to be careful not to get sucked in by the power of rebates and forget about actual net costs, because those big checks may not tell the whole story. The next time we'll talk with Bob, we'll ask if there was any way we could save even more money, this time by comparing generic drugs with generic drugs. I predict you'll be pretty surprised at Bob's answer. If you have any questions in the meantime, be sure to go to ExcelsiorSolutions.com or give them a call. Thanks for watching. We'll see you next time on Excelsior TV.